For most of human history, doctors believed the cure for sickness wasn't medicine. It was bleeding. Imagine stepping into a medical room centuries ago. The walls are stone, cold, and damp. Candles flicker weakly in the darkness. The air smells of herbs, sweat, and iron. A physician approaches you slowly. He doesn't carry pills. He doesn't bring bandages. Instead, he holds a sharp metal blade. And the treatment he's about to perform is something that dominated medicine for nearly 2,000 years. Bloodletting, a practice that once defined healing, and sometimes defined death. The strange belief began in the ancient world. Greek physician Hippocrates, often called the father of medicine, proposed a theory that would shape medical thinking for centuries. According to him, the human body was governed by 4 essential fluids, known as the humors: blood, phlegm, yellow bile, black bile. Health, he believed, depended on these humors remaining perfectly balanced. When the body became ill, it meant something inside had shifted out of harmony. Later, the influential Roman physician Galen expanded this idea. Galen's teachings became medical law across the ancient and medieval worlds. His theories were copied into textbooks, taught in universities, and accepted as unquestionable truth. And among all 4 humors, one fluid seemed to dominate the conversation: blood. Blood was seen as the most powerful and abundant of the humors. If someone developed a fever, suffered headaches, experienced swelling, or displayed strange behavior, many physicians believed the cause was simple. There was too much blood in the body. The solution? Remove it. At first, bloodletting seemed logical within the framework of ancient medicine. If illness was caused by excess fluid, draining some of that fluid might restore balance. And so the blade became a medical instrument. Across Europe, the Middle East, and parts of Asia, physicians practiced venesection, the deliberate cutting of a vein to release blood. Patients would sit quietly as a cloth or leather strap tightened around their arm. The pressure forced the vein to swell beneath the skin. Then came the moment of incision. A small slice. A thin red stream would begin flowing into a waiting bowl or basin. Doctors often measured the amount carefully, watching for signs that the patient was improving. But sometimes they simply kept going until dizziness set in, until the patient fainted, until the physician believed enough blood had been removed. Bloodletting was not rare. It became one of the most common medical treatments in history. Doctors prescribed it for fevers, infections, pneumonia, headaches, and even emotional conditions like melancholy or hysteria. Some physicians recommended routine bloodletting for healthy individuals as a way of maintaining balance in the body. In medieval cities, this procedure was so common that another profession became deeply connected with medicine: barbers. Barbers already worked with sharp razors, and many were skilled at handling blades. Over time, they began performing minor surgeries and medical procedures alongside haircuts. These barber-surgeons became essential figures in many communities. Outside their shops stood the iconic red and white striped barber pole. Today it simply represents a haircut. But historically, the red stripes symbolized blood, while the white stripes represented bandages wrapped around the patient's arm during bloodletting. Inside those small shops, customers might come in asking for a shave and leave having lost a pint of blood. The tools used for bloodletting evolved over time. Some physicians used simple knives or lancets designed specifically for cutting veins. Others used mechanical devices that snapped small blades against the skin to create precise incisions. But sometimes doctors turned to a far stranger assistant: leeches. These small parasitic worms had a unique ability. When placed on human skin, they attached themselves instantly and began feeding on blood. Their saliva contained chemicals that prevented clotting, allowing blood to flow freely while they fed. For doctors who practiced bloodletting, leeches became a perfect medical tool. They required no blade, no cutting, just patience. Hospitals began keeping large glass jars filled with hundreds or even thousands of leeches. These dark, wriggling creatures were stored in water, waiting for the next patient who needed treatment. During therapy, doctors would place several leeches directly onto the patient's skin. The animals would latch on and slowly swell as they drank. One leech might consume several times its body weight in blood before detaching. Patients sometimes endured dozens of these parasites feeding on them at once. For many, the experience was disturbing, but it was widely believed to be healing. During the 18th and early 19th centuries, bloodletting reached its peak. Some doctors became famous for prescribing enormous amounts of blood removal. One of the most influential physicians of this era was Benjamin Rush, a prominent American doctor who strongly believed in aggressive bloodletting as a cure for disease. Rush and others argued that many illnesses were caused by inflammation, which they believed could be reduced by removing large quantities of blood from the body. In certain treatments, patients lost staggering amounts of blood within a short period of time. Weakness, fainting, and extreme fatigue were common, but doctors often interpreted these symptoms as signs that the treatment was working. In reality, many patients were simply losing too much blood to survive. One of the most famous victims of bloodletting was George Washington. In December of 1799, the former President of the United States developed a severe throat infection after spending time outdoors in cold weather. He awoke during the night struggling to breathe. Doctors were called immediately. Following the best medical knowledge of their time, they began treating him with bloodletting. The first doctor removed a portion of blood from Washington's arm, but his condition did not improve. Soon another physician arrived and performed the procedure again. Still, Washington struggled for breath. More blood was taken, and then more. By the end of the treatment, doctors had removed nearly 40% of his body's blood. Weak and pale, Washington's body could no longer sustain itself. He died later that same evening. Many historians believe that the bloodletting itself played a significant role in his death. But at the time, the doctors believed they had done everything possible. They had simply followed the standard medical practice of the age. Despite tragedies like this, bloodletting continued for decades. Medical traditions can be incredibly difficult to abandon, especially when they are supported by centuries of authority. Doctors had studied the writings of Hippocrates and Galen for generations. Universities taught the humoral theory as scientific truth. To question it meant challenging the entire foundation of medicine. But slowly new discoveries began to change everything. During the 19th century, advances in scientific experimentation and microscopic research started revealing a very different understanding of disease. physicians began observing bacteria and microorganisms under microscopes. These discoveries suggested that illness was not caused by an imbalance of mysterious fluids. It was caused by infections and biological processes inside the body. As evidence grew stronger, the humoral theory began to collapse, and with it, the practice of bloodletting slowly faded away. By the late 1800s, most modern physicians had abandoned the practice entirely. Medical science had entered a new era. Yet strangely, bloodletting never disappeared completely. In certain rare conditions today, controlled removal of blood is still used as a medical treatment. One example is hemochromatosis, a disorder in which the body absorbs too much iron from food. Excess iron accumulates in organs and tissues, causing damage over time. To treat the condition, doctors periodically remove small amounts of blood from the patient's body. The procedure is carefully controlled, sterile, and based on modern scientific understanding. In a sense, the ancient practice of bloodletting still survives, but now it is guided by evidence rather than superstition. Looking back, the history of bloodletting reveals something both fascinating and unsettling about human progress. For nearly 2,000 years, intelligent and well-meaning physicians believed they were saving lives. They studied ancient texts. They followed established knowledge. They trusted the wisdom of generations before them. And yet, many of their treatments may have caused more harm than the diseases they were trying to cure. It's a powerful reminder that medicine is constantly evolving. What seems certain today may one day be replaced by new discoveries. And sometimes the line between healing and harm can be thinner than we realize. Imagine that dim, candlelit room again. The physician standing over the patient, the metal blade glinting in the flickering light. For centuries, that moment represented hope. But history now reveals something different. A time when humanity fought illness with courage, but not always with understanding. And when the most trusted cure in medicine was simply to let the blood flow.